Course title: Reproductive Health Care. Module 1: Foundations of Reproductive Health. Welcome to Module 1 of our comprehensive course on reproductive health care. In this module, we will explore the foundational principles of reproductive health, including reproductive rights, major components, the health situation in Nigeria, gender roles, and sociocultural influences. Overview of reproductive health and reproductive rights/ICPD. Reproductive health refers to the state of complete physical, mental, and social well-being in all matters relating to the reproductive system. It implies the capability to reproduce and the freedom to decide if, when, and how often to do so. The concept of reproductive rights emerged prominently during the International Conference on Population and Development (ICPD) held in Cairo in 1994. This conference emphasized individual rights to reproductive autonomy, access to reproductive health services, and education. Philosophy and concept of reproductive health. The philosophy behind reproductive health care is rooted in human rights, gender equality, and the right to the highest attainable standard of health. The core concepts include access to safe and effective family planning, education, safe pregnancy and childbirth, and the prevention and treatment of sexually transmitted infections. Components of reproductive health. Reproductive health encompasses various components such as family planning, maternal and child health, prevention and treatment of sexually transmitted infections, STIs, adolescent sexual and reproductive health, infertility management, cancer screening and prevention, menstrual health. Reproductive health situation in Nigeria. Nigeria faces significant reproductive health challenges including high maternal mortality, limited access to contraception, low utilization of skilled birth attendants, and widespread gender inequality. Adolescents and rural women are especially vulnerable. Cultural taboos and limited healthcare infrastructure hinder progress. Roles of family members in reproductive health. Reproductive health is not only a woman's concern. The roles of family members are critical. Fathers, supporting maternal health, participating in family planning, and promoting girl-child education. Mothers, promoting healthy reproductive practices, antenatal care, and education for daughters. Children, receiving education and being protected from harmful practices. Significant others, including community elders, religious leaders, and peers, all influence beliefs and behaviors. Health status of women, girl-child education, and gender discrimination. The health of women directly impacts families and communities. However, due to gender discrimination, many girls are denied education, early marriage is prevalent, and access to reproductive services is limited. Educating the girl child improves health outcomes, reduces fertility rates, and promotes economic growth. Factors influencing reproductive health. Multiple factors influence reproductive health. Cultural, beliefs around sexuality, fertility, and gender roles. Socioeconomic, poverty limits access to care and nutritious food. Educational, education correlates with lower fertility and improved maternal health. Political, government policies and funding affect the availability of services. Role of the nurse in reproductive health. Nurses play a vital role in providing reproductive health education, conducting screenings and tests, offering family planning services, assisting in childbirth and postnatal care, counseling and emotional support. Cultural influence on the nurse's role. In many settings, cultural norms may hinder or shape a nurse's ability to deliver services. It is essential for nurses to practice cultural sensitivity, advocate for women's rights, and work within communities to promote acceptance of reproductive health services. This concludes Module 1. In Module 2, we will explore human sexuality and the anatomy and physiology of the reproductive system.